Hello dear colleagues, so today we will go through an interesting case of a 27-year-old female who presented with complaints of right arm tremors and acute loss of memory. Have a look at the case. This is the diffusion weighted sequence. Here we can see hyperintense signal intensity in the cortex of the left frontal lobe, as well as in the caudate nucleus and left lentiform nucleus. Right side appears to be normal. Subtle corresponding low signal intensity on ADC map imaging. And no corresponding abnormality on the T2 weighted images. Also no corresponding abnormality on the FLIR imaging. So this is the typical appearance of Creutzfeldt-jakob disease. So what is Creutzfeldt-jakob disease? Creutzfeldt-jakob disease is prion-mediated disease that results in rapidly progressive dementia and death, usually within a year from onset. Prion is a type of protein which manifests in sheep and in cow. They can alter the structures of the body proteins. Sporadic CJD represents the most common prionic disease in humans, accounting for approximately 85% of the reported cases around the world. Familial and acquired forms are occasionally encountered. MRI is the modality of choice for assessing Creutzfeldt-jakob disease. The most sensitive sequence is diffusion weighted imaging, which shows hyperintense signal intensity and which are less conspicuous on T2 weighted and FLIR images, as well as on the ADC map imaging. The most common MR imaging pattern in sporadic CJD consists of hyperintensity in the cortical and basal ganglial regions, insula and cingulate gyrus. In addition, involvement of the superior frontal gyri and the cortical areas near the midline, as in our case. The usual findings are focal or diffuse symmetrical or asymmetrical involvement of the cerebral cortex, basal ganglia, in particular the corpus striatum, or both basal ganglia and cerebral cortex. Perirhodontic areas are usually spared and there may be cerebral atrophy. Unusual findings may be involvement of the perirhodontic cortex, pulvinar and double hockey stick sign can rarely occur in sporadic CJD. DWI hyperintensity involving cerebellum may also be observed. Other investigations may be EEG, CSF14-3-3 protein, CSF for olfactory mucosa for real-time quaking induced conversion seeding assays, and fluorine 18 FDG PET. Thank you.